Okay, good morning, everybody. Dr. Rafich here from Vet Triage. August 28th, 8:27 a.m. Pacific time. Let's talk about seizure versus syncope. So this is a common vet school question for vet students, and pet owners, of course, also will struggle in knowing the difference between the two, or even knowing those are your two options. But oh, the live stream may have restarted. I'm not sure, so I'll just start over again. Sorry for those in the playback. So it's August 28, 8:27 a.m. Pacific time. I'm Dr. Shadi Arafij, owner of Vet Triage. We're going to be talking about seizure versus syncope. So this is a very common vet school topic, and pet owners also may have difficulty in figuring out which of the two they saw in their pet, or that there are even two options. So let's talk about the differences in brief, and then we know what you can do about it. Um, so seizures are a neurologic symptom of something else happening. It's the result of an abnormal balance of neurotransmitters, chemicals in the brain. And when there's enough imbalance, it creates basically an overload of the system, and a seizure happens. And I have a video on this channel regarding seizures in more details, but just in brief, there are three causes of seizures. Even though it's a neurologic symptom, it is still a symptom. And so usually something is causing it. So three categories of seizures are something's in the brain causing a problem. So for example, a stroke or brain tumor, infection, things like that. Second category is something in the body, so outside the brain. So usually something metabolic, so kidney disease, liver disease, etc. Hey, Daniel Brown. Hi, how are you today? Good morning, New Zealand. Welcome to Yes Good, my friend. Love good dogs. Yeah, thanks, man. Thanks for the support. Good seeing you. If you have any questions, let me know. So metabolic causes, so things like liver disease, kidney disease, toxicities, etc. And the third category of seizures, once the doctor rules out the first two categories, is idiopathic epilepsy. Idiopathic means we don't know the cause. Epilepsy is typically a congenital, meaning you're born with it, brain abnormality that causes an imbalance of chemicals in the brain. And it doesn't have to be when you're born. It could be later onset. But anyway, if you rule out the first two causes of seizures, the third category of idiopathic is what you think of when you think of like children who have seizures, for example. So those are seizures. This is what seizures look like. They can come in different characteristics. Is typically a whole body aggressive tremoring, salivating. The pet is awake but not aware of their surroundings. They usually will urinate and defecate during it. They are it can last as long as just a couple of seconds, or it could be minutes or even hours, depending on how bad it is. And that's a seizure, foaming at the mouth. Now, you can look up on YouTube videos on seizures if you want to. Just warning, it could be a bit graphic. But there are also, and that's a grand mal seizure, it's an entire body. There are also partial seizures and other types of seizures that we're not going to go into. Your neurologist will have more of that information for you. But a seizure is typically a very active, aggressive process that involves the whole body. Now, if you're not sure if your dog had a seizure or not, and you're able to record it on video, definitely do that. It'll help our doctors on Vet Triage. It'll help your family veterinarian when they're open. So definitely record the episode. I understand that it's hard to know when an episode is going to happen, if it'll happen again at all. And I also understand that it could be over before you even can get your video out, your camera out. So you do the best you can with that. Now, syncope, which is the alternative to seizures, means collapse, and typically it means cardiovascular collapse. So syncope is passing out. Passive, just passing out. There's no warning, there's no tremoring. There can be peeing during it, there may be pooping, but they're not awake during it, they're unconscious, and typically is because of poor blood flow, poor oxygen to the brain. Typically is due to heart disease, like severe heart block, for example, and um, they collapse. And the thing is, pet owners will see that and think that's a seizure when in actuality it's actually syncope. Now, it can be difficult to tell between the two because there's some of the symptoms overlap, but usually that syncope is a very sort of calm, quick. They pass out and then they wake up again. Obviously, you can have very severe syncopal episodes that last longer, or ones that are life threatening. But in general, they collapse and then they wake up. There are other causes for syncope. So, for example, stimulation of the vagus nerve. So the vagus nerve is cranial nerve 10. It comes from the brain and goes. It's quite extensive, but it goes down the neck, into the chest, into the abdomen, and it functions to control many things. But it has heart control. It has gastrointestinal control. It's very powerful nerves, the vagus nerve, and if there's compression of the vagus nerve, then you get a vagal reflex, which causes syncope, which can cause syncope, not always, but it can, and so they'll collapse. So that's another reason it's non-cardiac necessarily. And for example, that'll happen if the patient's in surgery and the surgeon pushes on the eyeball, it'll create the vagal reflex, for example. Or if a dog is throwing up, signs of vomiting is in such a way that it overstimulates the vagus nerve, and then you have a syncopal episode. So, yeah. And one final thing I forgot to mention about seizures: after the seizure is over, there's typically a period of time where your pet is not normal. That period of time could be seconds to a couple of hours. That's called the post-ictal period. So pre-ictal, PREICTAL, is before the seizure, ictal is during, post-ictal is after. And so there's typically a post-ictal period of time. Whereas with syncope, you don't see that. You don't see a post-ictal period. With seizures, you usually will. And that can be characterized by disorientation, blindness, circling, whimpering, walking all weird. But as long as they don't have another seizure during the post-ictal period, then they only get better with the post-ictal period. That's not the same thing as having like permanent brain damage from a really bad or long seizure. That's very different. Post-ictal is expected. It should self-resolve, and it should be transient. But in either way, you're going to want to video the pet if you're able to. And because these things happen so quickly, and they usually happen in the middle of the night or whatever, you want to contact vet triage. And other than recording it, specific therapeutics for this intervention should be at the discretion of the veterinarian. The veterinarian on vet triage needs to probe what's going on with your pet, history, what led up to this, how your pet looks now, and decide is it an emergency or not. And if it is an emergency, let's get you help. If it's not an emergency, which not always is, then we'll help with advice. In fact, most of the time, at least on vet triage, a seizuring or syncopal episodes, they're not emergencies. They could wait. If it's a seizure episode, typically the seizure is already over, and we can go through kind of what our guidelines are for when a seizure is an emergency, is not an emergency. And if it's syncopal, typically the pet's normal on video because it happens so quickly. And then it's a matter of just investigating further to see whether or not this is a severe cardiac condition. Can we figure that out on video or not? And if it's not, then let's, or at least if it's not severe, let's get you advice and monitoring parameters until your veterinarian is open again. But all right, I think that'll be it for this one. Daniel Brown, thanks, man, again for joining and commenting. Thanks to those who are watching the playback. Feel free to subscribe, donate, share, like, all the things, and I'll see you tomorrow, August 29th, for another video. Take care.